All hospitals need blood supplies to do what they do best, but perhaps no hospital is more in need of a steady supply than MD Anderson Cancer Center. But in this time of a pandemic, the opportunities to collect blood through the many drives that we normally see, that's been severely limited. And that's what makes the scheduled community blood drive coming up this next week even that much more important. Joining me this morning, Dr. Kimberly Klein, Associate Professor of Lab Medicine at MD Anderson, to talk about how important this drive is. Good morning, Dr. Klein. Good to see you. So what kind of impact have you seen negatively as it relates to your ability to get the kind of blood supplies you need at MD Anderson?
So what many people don't know is that MD Anderson requires more transfusions than any other hospital in the nation. We are the #1 cancer center in the region, and our patients are highly dependent on transfusions for their care. We need about 200 units of red cells every day and 600 units of platelets to support our patients daily. Because of COVID and schools being closed for the summer, we have had decreases in the amount of blood drives that we can perform in order to acquire these donations, especially during holiday times, such as Labor Day coming up. It makes it exceedingly difficult for us to get the blood that we need.
Talk a little bit about how those are used. I mean, once you get it, what do you use it for primarily? Is it more transfusion? Is it more for platelets, plasma? Just what kind of needs are you mostly used at MD Anderson?
In general, depending on what the patient needs, if they are anemic, for example, they have a low hemoglobin level, we'll give them a unit or two of red blood cells. If they have problems forming clots, they could potentially either need plasma or platelets, depending on their laboratory values. So it depends on what the patient's lab data shows and what's going on with the patient. But in general, all the units are used for transfusion, and one donated product can save up to 3 lives.
Is there one particular area of collection that you are missing most right now? I mean, you mentioned schools, you mentioned some other things. Do you get a lot of donations from schools, for example?
We do get a lot of donations from schools, and we're very grateful for that. We also have a lot of community drives as well that corporate sponsorships have not been able to allow us to do.
So this drive coming up this week, community drive, what's it entail? What do people need to do in order to get involved? Are there any prerequisites, or they just sign up and come in?
Sure. Our drive is going to be, we're going to have 3 different days, August 24th, 26th, and 28th at the 1MC building in the Texas Medical Center. Parking is free, masks will be provided, and temperature screening will be in place. They just need to sign up either through calling 713-792-7788 or visiting us online at mdandersonbloodbank.org.
Now, we're monitoring some weather in the Gulf right now. What happens if there's an issue with weather and say they have to cancel? Will you get in contact with them, or how does that work?
One of our donor center staff will be in contact with them, correct.
Okay. And when you come in to do it, do you just want straight blood, or do you collect the platelets as well?
Sure. We can either collect platelets via apheresis, which takes a little bit longer, or you can donate whole blood, which takes about 10 minutes, and then we would get a unit of red cells, some platelets, and plasma as well.
I want to put the information on the screen, if I can, in terms of what's going on here. We're talking about basically Monday, Wednesday, and Friday, and from 9 a.m. to 3 p.m. You've given the information. I'm also going to make sure that I put it on my website so people who need to have that information will be able to do so. Thank you so much, Dr. Klein. How long have you been doing this, by the way?
I've been at Anderson since February of this year, but I have been across the street at UT for 7 years.
Right, so you know the issues very well, and in that medical center, I was surprised to hear that you're the largest in the world, I mean, in the country, or is it the world, in terms of how much blood you need? You said you need more than most.
We need about 100,000 units every year to support our patient.
Okay. Thank you so much. I appreciate you this morning. We're going to put all this information on my Newsmakers page on click2houston.com. Thank you, Dr. Klein.
Thank you.